Hello.
It's been a while.
In a minute.
I
A
know.
long minute.
I know, right?
Yeah.
All right. Here we are.
Back again.
So before we go on,
Mm.
we're going to change the name of our YouTube channel.
Yeah. We have some good stuff coming your way. Like we have changed our name to
My medical diaries.
Yes, we don't want to scare you off because of staying even in sickness. Yeah, we don't want to scare anybody off. So we're going to be talking about medical diaries.
And we're going to do it in what did you call them?
Reels.
Yeah.
Oh.
Yes, there is reels.
Yeah.
Like phases. What do they call them?
Series. A series.
Oh, right. Yes. So we are going to start with the children's series. Yes. So we are going to be addressing several topics that commonly affect
the babies, the children. Yeah. So that is season 1. Children are a priority.
Yeah. After that, we will know what to do. We'll tackle women. We'll tackle all those things. Yeah. Exactly. So that is it for now. Today we're going to talk about something that is very common and disturbs a lot of mothers, new mothers, old mothers. I mean, and we're going to tell you how to manage, not to panic. Yes. So we're going to talk about fever. Now, my name is Anne Maina, Dr. Anne Maina.
I'm Tama Nyambura. Yes, I'm Anas.
Yes. And you can follow us on our socials.
Yes.
Instagram, TikTok,
yes,
Facebook,
yes,
and don't forget to subscribe.
Yes, on our YouTube channel.
Please don't forget to subscribe so that you can be updated as we put out these episodes. We're going to be doing very short stuff so that you guys don't get bored.
Yeah, we don't want you guys to be spanning, like, you concentrate for 20 minutes and then you're done.
I know.
Yeah, we want you to stay. Yes.
All right. So right to it. Fever.
Yeah, that's a common it's not a condition. It's a common thing in children. And the definition of fever is high body temperature. So the normal body temperature is between 36.8. Yeah, to 37.2. So if your kid, okay, so that is just the numbers. But when you have a child at home, you don't have a thermogun. How do you know that your child has fevers? So it is just feeling your body, your baby's skin, and you feel like this baby's temperature, like una feel tu ako na joto kwa mwili. Generally.
Is that dependable? Usually.
With
hiyo kusikiza tu mtoto kwa skin.
Unajua sasa when you as a mother ukiguza you are the one with the child, or as a father whoever is with the kid.
Anyway, kuna vile tu utasikia kona.
This is not normal.
Kuna vile tu utasikia obviously akona joto. I know it's something that makes mothers run.
Very fast,
yeah, because
so first aid at home. Before you start running, mama, first take off that baby's clothes. Toa kila kitu kama itabidi. Kama ile joto unasikia kwa mwili ni mingi, like your baby is burning up. Toa nguo kwanza. Hata usibakishe diaper, sijui napi.
Yeah, diaper kwanza inakuanga na a lot of heat.
Yeah. Kama uko na kaleso or a line, umekelea mtoto tu in an open space, kama kwa kiti or somewhere safe, pia malezi anguka, and then take off the clothes. The second thing, actually the first thing we should tell them is not to panic. Don't panic and then not take off the clothes. When you panic, you get confused on what to do.
It's very true. Usually I know the first thing that usually they think ni kukimbia hospitali.
Yeah.
So unapata mtoto ameletwa hospitali, they are all covered, akona jacket, akona all those shoes, nini. Yeah.
Na sasa ukimleta na hizo mashow, you are adding up
to the heat. Yeah.
Yes.
So undress
the baby first, and then do some bath sponging.
Sponge bathing.
Liner. weka maji na maji warm and then touch the baby like every part of the baby, guza yeye pole pole hivyo. Usimguze na maji baridi it lead to shock, like the baby's sensitivity
and even hypothermia.
Yeah,
hypothermia.
Sasa iko juu and then sasa you make it to drop.
So the reason behind sponge bathing is because ukimpanguza na hiyo maji moto the water evaporates.
Yes.
So as it evaporates, it cools the skin. Yes, that is it. So are those the main first aids?
Those are the first thing we first do.
And by the way, in 90% of the cases when you do that, when I see my patients at hospital, I always tell them 90% of the time, undress, sponge bath.
Yeah.
90% of the time fever inaisha. Sawa.
Yeah.
So but apart from kuguza mtoto hivi ndio ujue kuna joto, obviously there are other telltale signs and symptoms zenye unaweza angalia. By the way, fever inafanyanga mtoto akae mgonjwa.
Very bad.
So utapata the baby is breathing very fast. There is that fast breathing. Then apart from that, if it's a baby between maybe 0 to 3 months, atakuwa na irritability, hiyo kulialia, like but for a baby who is a bit older, atakuwa restless.
Yes.
But for 0 to 3 months, usually restlessness comes with irritability. But sasa later in older children, restlessness ni ile yenye mtoto hakai, like hapumziki, ako tu kwa kitanda, they're just standing, ameamka, nini, kulialia.
Imagine how a baby is restless. As an adult, it's very uncomfortable. So kwa mtoto
actually hata mama halalangi. Then obviously between 0 to 3 months pia atakuwa na difficulty feeding, ama difficulty breastfeeding, things like those. Those are the main signs. But then of course now the signs will also depend on what is actually causing the fever.
Yes.
And in most cases, wacha tuseme between 0 to 3 months, usually the first thing by then is teething. Because utapata watoto wa 0 to 3 months hawagonjekangi sana unless ulimu-expose kwa mtu akona homa nini. Usually it's teething, especially between 5 months, 5 to 6 and a half hapo. Teething. So utaona unaweza ona kwa nini, kwa mdomo. Kwa gum.
Yes.
The gum is what, swollen,
Yes,
it's a bit swollen. Alafu utapata mtoto every time utaona tu there is something, ama anaeka mkono, something like that. So it comes with teething. Hiyo ya teething inaweza kuja sometimes na vomiting ama diarrhea
kidogo
not so much. But fever, diarrhea, and it's not diarrhea actually, it's loose stool. There's a difference between diarrhea and loose stool, which we will cover in some other episode. It's just loose stool. Zile kidogo tu ni ile yenye, hiyo loose stool ni yenye iwezi fanya ati mtoto akuwe dehydrated per se, but still then obviously sasa there are other causes zenye itakuja na hizo signs and symptoms. Usually ni flu.
Just a flu, a bit of infection, ama ni just nini URTI kidogo. I'm sure you exposed the baby somewhere, ama ameguzana na mtu kapata kahoma kidogo.
So itakuja na other signs like cough, refusal to feed,
inactivity, ile there's a certain
lethargy. That lethargy, unaona mtoto ameboeka
tu. Hivyo ndio wao mnasema mkikuja.
Sleeping a lot. Sasa hizi signs usually kuna kuangana zile signs za 0 to 3 months. Kama atakuja na cough, refusal to feed, ama hiyo difficulty in feeding, hiyo kungorota. But for older children obviously, sasa kama ni maybe URTI like tonsillitis, atasema akona sore throat, ama pain on swallowing, such things.
Tumesema URTI.
URTI is upper respiratory tract infections. Usually. So no, if that is the cause, fever will always be associated with other signs and symptoms.
Haikuji peke yake.
Then what other thing causes fever apart now from to URTIs?
Na teething.
Teething. Of course, G.
Hata G, by the way,
G is gastroenteritis. It's basically vomiting and diarrhea. It can also come with fever.
Yes, even immunizations, you know.
Oh, right. Tell us. Yeah, immunizations.
Yeah, see, you know, when we give babies vaccinations at 6 weeks, 10 weeks, and 14 weeks. So those immunization cause a little bit of fever. And mostly, so we just tell the parent, but a bit of kama uko na paracetamol, but we actually recommend Calpol. Kama ako nayo sasa, si you know, we quote the dosage ya kumpatia afterwards. And of course ukienda home, you just keep the baby on light clothing. Kama you feel, utaona kama atakuwa na joto kwa mwili, yeah, keep the baby on light clothing. If you feel like you need to give after you've undressed and you have done sponge bathing, it is not working, and then now you give the paracetamol. If it's not working, just come back to the hospital.
Yeah, obviously, yes. Yeah. So I think on the causes, we've talked about URTIs, we've talked about teething, we've talked about immunizations, and infections can either be bacterial or viral. Usually viral haikuangi na fever iko juu sana. Apart from tonsillitis inakuanga na fever ingine.
That one doesn't go down easily actually.
It doesn't.
Until I think we actually manage the cause. So, which is the viral infection.
And something very important I forgot to mention on the signs and symptoms is convulsions. Because hiyo ndio inafanyanga sasa parents wanakaa ni kama wameshtuka, wanaona mtoto anaenda sasa.
A mother can go crazy if especially they don't know what is happening.
You know, convulsions, fits. Ile mtoto ana
sitting, kicking, and amekaza mikono, the limbs and the lower limbs. Mikono na miguu, sorry. Yes.
Fever will cause that. Sometimes hata ni homa tu ama pneumonia, but fever will cause convulsions. Usually kuna watoto, there are kids who are prone to convulsions, usually between 6 months to 6 years. After that inafaa kuisha. So that is another sign and symptom. I think we've talked about the signs and symptoms, we've talked about first aid, we've talked about causes. What is remaining? Maybe just management. But before we go to management, there's something also that we do at home. When it comes to paracetamol.
Yes.
Because sasa paracetamol, unajua watu wamezoea madawa sana. One thing you should know, paracetamol syrup, the moment umeifungua, after 14 days, just dispose it. Sababu
it is like haitakusaidia.
Ukipeana after 14 days after kutoa hiyo nini inakwanga the cup.
Yeah, the cup.
14 days after just dispose it. I think hapo ndio watu wanaendanga wrong, because unasikianga ati hata alienda kwa neighbor akaomba paracetamol ya mtoto yenye ilinunuliwa a month ago, you know. So unapea mtoto paracetamol and it's not working. Unakuja hospitali unasema hata nimempea
haijafanya.
Then the other thing, and I think it's dosage. That's where we also go wrong.
You know, people don't know, children, they don't just hatuwapei dawa kama venye watu wazima wanapata dawa. You have to know the kg so you can get the accurate dosage.
Yeah, it's very important. Now in most cases hizi madawa zinakuanga na those leaflets inside. Na zinakuanga by the na dosage. Zinakwambia a child between this kg and this kg give this amount. This kg and this, unajua mostly
they don't read them.
Yeah, they don't. And then I guess pia ni kununua over the counter.
Thank you. I wanted to say that. Anaambiwa enda pay 5 meals, enda pay 2.5 meals, lakini hatujapima kile mtoto.
I know. So unapatanga mtoto mwenye ako below 1 year, mara mingi anaandikiwa 2.5 meals. Mtoto wako below 1 year, tuseme yako 6 months. 6 months mtoto anafaa kuwa na kilo ngapi?
Inafaa
estimation
inakuanga
about Just give us like a rough estimate. That's what I want, like 6 months.
Tuseme, okay, I want to use this analogy first so that I can do the math in my head.
All right.
So at birth, the kgs at birth, at 1 year, the baby is supposed to have multiplied that kg by 3. So kama alikuwa 3 kgs at birth. Yes, at 1 year. Okay. So roughly 6 kgs wako kama 7.
Okay. Yes. So mtoto wako 7 kg. Usually dosage ya paracetamol inakwanga 15.
Yes.
15 milligrams per kg. So if we say 15 times 7 inakuwa?
15 times 7 is 105.
105.
Wow. Hey guys. Ni 105.
Ni 105?
Yes.
Yes, sure.
Yes, because 15 times 6 is 90. So 90 plus 15. Ni 105.
Okay. Sawa. I don't know. 105, she has said it. Haya. So, huyu mtoto wako anafaa kupata 105 milligrams.
Yes.
Thrice daily. Aya, so ile paracetamol yenye tunakwanga nayo inakwanga ya 120 ama 125? 125 milligrams in 5 meals.
Yeah.
So ukiambiwa upe huyu mtoto 2.5 umempea ngapi? 60 what?
Umempea kidogo.
Umempea 60. 125 divided by 2. Our mathematician. 125 divided by 2?
6 point something.
60 something.
60 point something.
Umempea 60 around 60 what? Aki
60
yes, imagine umempea 60 milligrams
na
anafaa kupata 105. Lakini juu tumezoeanga tu unaenda kwa pharmacy unaandikiwa 2.5 mils for kids below 1 year. 2.5 mils 3 times daily. So the dosage equals so low, you know.
It won't work.
So definitely it won't work. Kama hata mtoto wa 5 year wa 1 year sasa ako 9 kg.
Umempea under dose.
Alafu umempea 2.5 mils. Like hiyo tu like anyway. So what I'm saying is after 14 days dispose of paracetamol, and not only paracetamol, all syrup.
Yeah.
The moment you open the cup, 14 days dispose, then dosage.
Yeah.
Ukiangalia ndani ya leaflet ndio tusikupeleke kwa maths mingi. Ndani ya leaflet ya kama paracetamol yako umenunua na haina leaflet, hiyo I think uliomba, either uliomba ama imekaa sana. In that leaflet wanakuanga wameandika vizuri. Na mama anajuanga, mama mwenye anafuata clinic vizuri anajuanga kilo ya mtoto. Yeah, they know.
So we even have the books za clinic, of course atajua.
Okay, then management we've already talked about paracetamol.
Paracetamol, yes. Akikuja hosi we treat the cause.
Yeah, obviously we treat the cause. So sometimes utakuja hospitali tukwambie it's just teething. Tukuandikie paracetamol uende nyumbani. Yeah. When people usually come to hospital they have expectations of
this is something concerning, it's very big. Okay, I need to calm down. You expect a lot of things to be done.
But of course we will do the blood test to rule out a bacterial infection. But we will reassure you, obviously. But of course, if it is a serious infection, especially bacterial infection, we will give you antibiotics. Kama ni wa kuadmitiwa, admitiwe. But mainly that is fever. I think take home message for fever.
Take home message. First, don't panic. Second, follow the first aid that we have talked about.
Yeah.
And also don't just go running buying drugs over the counter. Yeah. Follow up on your baby's kilograms, clinic yake, Juu hata kama the baby is not meeting the developmental milestones when inafaa, maybe there's something else that we need to find out so that we can treat that is causing the fevers. Kama ni ile fevers imekuwa persistent all of a sudden and you're not getting the right treatment. Yeah.
That's okay. Yeah. Good. There's something else nataka tuguzie. Kuna watoto wanakuanga na fever too all the time. Like it is treated 2 weeks later akona fever. 2 weeks later akona fever. What is happening? Nini inakuanga ikiendelea hapo?
I think I would say ni hiyo under dosage.
Ama maybe the infections are not adequately treated.
Yes.
Ama wanapata tuji. There must be something, right? Then UTIs, by the way, especially for 2 girls.
Girls don't know that kids get UTIs.
UTIs, urinary tract infection, especially for young girls. sababu young girls especially sasa school going wakianza kuenda shule hawajui kutumia choo vizuri. So unapata msichana amekalia boli ya choo and then hiyo mkojo ya watu wengine inamrukia and then anakuwa na UTI. But since hakohoi hafanyi anything,
hakuna any manifestation symptoms like zinaonekana na mtu mwingine.
Na ye mwenyewe ajui ati akikojoa asikie kama washo anafaa kureport. So unapata mtu tu amekalia ka UTI ako tu na fever hatujui what is happening.
Alafu unajua pia when you come tunakuuliza what is going on, unasema tu ni fever but hatujajua like really hajasema other symptoms.
And when we do a blood test inaweza kosa kuonyeshana nini.
Yes, because we would need to now do a urinalysis
so that we can actually pick the UTI. By the way, why did we not mention UTI? Very important for school, for uto tusichana twenye sasa tumeanza kwenda shule, mambo ya choo,
sharing washrooms.
Please teach them how to hizo hygiene.
Even hygiene ya underwear.
And wiping, jinsi ya kutumia choo. If you're concerned ataenda shule, go to school, express your concern about maybe the cleanliness of the loo.
And if you have to go see the toilets, go.
Please go. At the end of the day, it's the health of your child. That's how waseme huyo mama anakuanga na mambo mingi. Ama huyo that parent has a lot of issues.
Because now the infections can ascend and then it becomes something serious.
And then for two boys, it's phimosis. So hiyo pia inaendanga very much unnoticed. Kuna phimosis ni anapatanga infection pale, unajua especially if they are not circumcised. Kuna bado wako na foreskin, unapata inatoa kauzaa because of infection. But since hajasema na nyinyi pia mjaangalia, it goes unnoticed. It goes unnoticed. So take note of that. All right,
like just check on your kids, on your kids' health. Ile kufuata to find out those little things that we miss.
All right,
this was fun.
We kept it short as we promised. And thanks for watching. Please don't forget to subscribe. Watch out for our reels.
Comment, like,
and ask us questions. By the way, we want you to ask us questions. Ask us anything about fever and tell us maybe what we missed so that maybe we can mention it in the next episode. But apart from that,
we're done now.
Adios.
That is it. See you next time.